Imagine a world where hospitals grind to a halt, screens frozen, patient records locked, ambulances diverted, and surgeries canceled. Not because of a virus like COVID, but a digital plague, a ransomware attack so vicious it held entire nations hostage. In May 2017, WannaCry struck, infecting 200,000 computers across 150 countries in hours, demanding Bitcoin ransoms to unlock vital systems. It wasn't just a cyber heist, it was a global health crisis, crippling the UK's NHS, slamming factories, and costing billions. Behind it, a leaked NSA superweapon, a shadowy North Korean hacking crew, and a scandal of neglected security that left the world vulnerable. Yet a 22-year-old hacker hero stopped it with a $10 fix. This is the story of WannaCry, a wake-up call, a betrayal, and a warning that in 2025, we're still not safe. Welcome to Biz Breakdowns. Let's decrypt the chaos. It's May 12th, 2017, and the NHS in England wakes to a nightmare. Computers flash red with a chilling message. Pay $300 in Bitcoin or your files are gone. WannaCry, a ransomware crypto worm, has slithered into 81 of 236 NHS trusts, blocking 19,000 appointments, canceling surgeries, and forcing hospitals to divert ambulances. Nurses scribble notes by hand. Doctors can't access x-rays or blood tests. At least 595 GP practices lose patient records, and 34% of England's trusts are paralyzed. The cost? £92 million in disruptions, with global losses hitting $4 billion. FedEx, Honda, and Russia's railways also buckle, but the NHS takes the hardest hit. Why? Its computers ran Windows XP, 17 years old, unsupported, and wide open to attack. The National Audit Office later slammed the NHS for ignoring 2014 warnings to ditch outdated software, calling it a disaster waiting to happen. Here's where it gets wild. WannaCry wasn't a random hack, it was built on Eternal Blue, a cyber weapon allegedly crafted by the NSA to exploit Windows Server Message Block, SMB protocol. This wasn't some basement coder's prank. It was a military-grade tool, stolen by a group called the Shadow Brokers, and leaked online in April 2017. Microsoft had patched the flaw in March, but many organizations, including the NHS, didn't update. Why? Budget cuts, overworked IT staff, and a belief that it won't happen to us. WannaCry spread like wildfire, using Eternal Blue to worm through unpatched systems, encrypting files and demanding $300 to $600 in Bitcoin. Only 338 victims paid, netting hackers $130,000. But the damage was done. Paying didn't even work. Sloppy coding meant no decryption keys were sent. It was chaos by design, and the NHS was its poster child. The scandal deepens. Who was behind WannaCry? The FBI, Microsoft, and the UK's National Cybersecurity Centre point to North Korea's Lazarus Group, a hacking crew linked to the 2014 Sony Pictures attack and a 2016 Bangladesh bank heist. Linguistic clues, Chinese and English ransom notes written fluently, others machine translated, suggest a sophisticated operation. Metadata showed computers set to Korea's time zone, and code similarities tied WannaCry to Lazarus playbook. Why healthcare? Some say it was retaliation for sanctions on North Korea's nuclear program. Others argue it was pure profit, targeting vulnerable hospitals with no backup plans. The FBI called WannaCry the first ransomware to hit medical devices, exposing how hospitals' reliance on outdated tech made them sitting ducks. Meanwhile, the NSA faced heat for hoarding exploits like Eternal Blue, knowing they could fall into enemy hands. But there's a hero in this story. Marcus Hutchins, a 22-year-old UK cybersecurity researcher, became an accidental savior. While analyzing WannaCry's code, he spotted a kill switch, a hard-coded domain the malware checked before encrypting files. If the domain was live, WannaCry stopped. Hutchins registered it for $10, halting the worm's spread in hours. North America and Asia dodged the worst, but infected systems stayed locked. Hutchins, tweeting as at Malware Tech blog, became a global legend, though he warned it was a temporary fix. Two more variants with new kill switches popped up, neutralized by researchers Matt Sweezy and Checkpoint. By May 15th, new infections slowed, but the NHS scrambled for weeks to recover. Hutchins' quick thinking saved billions, but he later faced unrelated hacking charges in the US, sparking debates over white hat hackers' treatment. The fallout was brutal. The NHS didn't pay the ransom, no UK trust did, but the disruption was catastrophic. A 2019 study found infected hospitals saw 6% fewer admissions, with 4% less emergency cases and 9% fewer elective surgeries, costing £5.9 million in lost activity. No deaths were directly linked, but delayed care likely harmed patients. The UK government admitted it hadn't rehearsed for a national cyber attack, and communication breakdowns, infected emails, down networks, hampered response. Globally, WannaCry exposed a truth. Critical infrastructure, hospitals, power grids, water systems, was terrifyingly vulnerable. In 2025, ransomware remains a top threat, with healthcare hit hardest. A 2024 Ascension attack across 140 US hospitals echoed WannaCry, forcing manual record-keeping and delaying care. Ex-posts warn of WannaCry-style attacks on IoT devices, and the WHO reports ransomware costs healthcare billions yearly. Here's the kicker. We're still not ready. The 2024 SonicWall Cyber Threat Report notes a 107% surge in IoT malware, and Sophos says 59% of firms faced ransomware in 2024. Hospitals now face threat-to-life crimes, not just financial hits, with gangs like Russia's Conti and North Korea's Lazarus thriving. The NHS has since patched systems and boosted cybersecurity, but globally, unpatched legacy tech and underfunded IT persist. The WHO's Tedros Ghebreyesus warned in 2024 that cyber attacks on hospitals are life and death issues, yet many nations lag in resilience. WannaCry's lesson? Patch fast, back up data, and never trust a secure network. In 2025, with AI-driven ransomware emerging, the next WannaCry could be deadlier. So, what's the verdict? WannaCry was a wake-up call, a mix of human failure, geopolitical games, and tech hubris. Was the NHS negligent or a victim of budget starvation? Is the NSA to blame for leaking digital nukes, or are hackers the real villains? And Marcus Hutchins, hero or scapegoat? You decide. If this dive into WannaCry's global health crisis got your adrenaline pumping, smash that like button and subscribe to Biz Breakdowns for more tales of ambition, scandal, and high-stakes drama. Next up, another saga that'll shock you. Check the description for what's coming. See you in the next one.